Hey everyone, my name is Dr. Lee with Dr. Lee House Calls. I am a house call or mobile chiropractor, which means I travel to you to provide chiropractic care in the comfort of your own home, office, or workplace. I am located in Metairie, Louisiana, just right outside of New Orleans. I serve Metairie, Kenner, River Ridge, Harahan, Lakeview, and parts of New Orleans as long as it's within a certain radius from Metairie. If you're interested in house call chiropractic care, you can visit my website at drleehousecalls.com. I do provide free phone consultations to see if house call chiropractic would benefit you. You can call or text 504-265-1499 to schedule your free phone consultation. In this video, I will be showing you how to perform mobility exercises and stretches for the Iliopsoas muscles, which are part of the hip flexors. So if you are someone that sits most of the day in front of a desk or a computer, more than likely this area will be tight. The reason why is because when you're in a seated position, your hip is flexed, and that causes these muscles, the hip flexors, to contract and shorten, and whenever you go to stand up, it's going to pull into your lower back, and this can cause lower back pain, lower back tightness, hip pain. So if you're dealing with that, give this a try. It may give you some relief. First, I want to review a little bit of the anatomy of the iliopsoas muscle, which is actually made up of two muscles, the psoas major muscle and the iliacus muscle. So the psoas major muscle, it originates from the lower back. You can see here in the picture on the side of the lower back, T12, L1 through L5, and that muscle goes into your pelvis and into the hip, and it inserts into the lesser trochanter of the femur, which is the hip. And the iliacus originates from the iliac fossa, which is the front part of the pelvis, and it attaches into the same area, the lesser trochanter of the femur. So the action of this muscle is hip flexion. So what is hip flexion? So whenever you are running, the action, whenever your knee is coming up towards your chest, that is hip flexion, or whenever you're sitting, that is hip flexion as well. So to perform this exercise, you're going to get into kneeling lunge position, and make sure your knees are not flexed too much. You want to get into a 90-degree position in both knees. Make sure the back is straight and squeeze the glutes. And to mobilize the muscle, you're going to bend the front knee to shift your body forward. And make sure you keep that glute squeezed so you don't hyper arch your lower back. And you should feel that stretch in the front of the hip. And I would do about 10 repetitions of the mobility exercise, and to stretch it, you're going to raise your arm above head. You should feel that stretch intensify. If not, you can side bend to the opposite side and hold it for about 30 seconds, and you can work up to a minute or 2 minutes.